Being a part of Aurora Cancer Care, it's a very unique group that I've recognized. Aurora Cancer Care has 5 social workers who are board certified oncology social workers. And basically what that means is our focus is working with patients with cancer and their loved ones, and the type of experience that I think we all can bring to the table as far as the types of circumstances that may separate cancer patients and the experiences that they have from other medical conditions. That's very important, and it's something that I think that we as oncology social workers can recognize and hopefully help assist those patients with those other concerns more related to their cancer experience. Aurora and the stem cell transplant program is it's a very good one, and we're continuing to try and improve it. We want to offer a multidisciplinary approach to the program, and what that basically means is we're now connecting the patient and the patient's loved ones with a number of different specialists, if you will. People who can talk with somebody about their diet, people who can talk with somebody about their financial needs, people who, like myself, can hopefully help patients and families deal with some of the social issues and things that arise. And I really like the direction in which the stem cell transplant program is going, as now we are able to provide all of those services in connection with the patient experience. As an oncology social worker, we work a lot with cancer patients and their loved ones, and it's a process. We try to work with them early on, and the goal really is to look at a number of different aspects of a person's situation. The medical piece is obviously very important. The emotional aspect of that, as far as how the individual is handling that, and also the social component as well. It's very important to take into consideration the entire facet of a person's care, and as a social worker, that's primarily what our goal is to look at the bigger picture. And so our focus then is in working with the patients really from the beginning, as far as their diagnosis and their loved ones, of course, in helping determine what needs might they have at that point, where can we be of assistance as far as offering supportive type programs and services, and also helping them understand some of the things we social workers can do throughout the entire process as they receive treatment, as they see the physicians, as they work with other members of the team. We try and coordinate that with everybody to bring it all together to make sure it fits for the patient. Looking at a person who is now possibly faced with stem cell transplantation, it's a pretty significant process. It's quite the journey, and there could be a lot of things on that individual's mind as far as basically even just planning their lives during this time in their life, which can be a very stressful one. And there is definitely the financial piece of it. There can be some costs involved and things that we social workers can talk with them about. But there's also that supportive element and a number of other services that we can offer to help at least try and ease some of that burden that they already are experiencing with their cancer, to make this entire process a bit more smoothly for them.